Hello, I will be presenting a CHI paper titled Supporting Experiential Learning in People with Gestational Diabetes Mellitus. This paper was written by Zaidat Ibrahim, Dr. Clara Caldeira, and Dr. Chung. According to the U.S. Center for Disease Control and Prevention, CDC, about 10% of pregnancies in the U.S. are diagnosed with GDM annually. Often diagnosed in the second trimester of pregnancy, GDM places the pregnant individuals and unborn baby at both short-term risk, for example, birth complications, and long-term risk, for example, mothers can develop type 2 diabetes several years after childbirth. Pregnant individuals with GDM adapt to temporal lifestyle changes through monitoring sugar levels 4 times a day and modifying diets to keep the unborn baby safe. While the lived experience of GDM is similar to type 2 diabetes, it is quite different in that individuals are pregnant, changes are temporal, and an unborn child is involved and needs to be kept safe. We sought to examine people's transformative experiences beyond simple reflection by answering the research question, how do pregnant individuals with GDM learn from, reflect on, and act on their experiences managing GDM? In our research and in our paper, we investigate the challenges pregnant individuals with GDM experience, encounter as they learn, reflect, and engage with their condition. To answer our research question, we recruited participants through 3 main channels: GDM-related Facebook groups, subreddit groups, and a research volunteer platform designated for research recruitment processes. Participants were currently pregnant and clinically diagnosed with GDM. We conducted recorded Zoom interviews lasting somewhere between 29 to 64 minutes. In order to analyze our findings, we leveraged the highly influential model for experiential learning, the Kolb's experiential learning cycle. The Kolb's theory described learning as a process in which knowledge is created from a transformation of concrete experience. To create knowledge, individuals start with the observation, reflection, forming abstract concepts, and finally testing hypotheses and concepts in new situations. While reflection can be helpful, simply triggering reflections does not always lead to the transformative effect that individuals want. Therefore, reflection alone fails to provide individuals with more profound understanding or knowledge to improve their action or behavior. In this case, participants have pregnancy and GDM diagnosis as their concrete experiences. The next phase, reflective observation, where individuals investigate and consider contextual conditions of a problem, and they may not yet have ways in which they can solve the problem. Then the third phase is abstract conceptualization, where individuals construct meaning, form hypotheses, and consider possible changes to the context conditions across time and place. And finally, active experimentation, where individuals move beyond comfort zone, utilizing theories formed or decision-making for their problem-solving needs. Our first phase of findings in terms of concrete experiences, participants described the stigma and well-being challenges, highlighting the emotional, mental burden and exhaustion from managing the GDM condition. For example, participant 3 here says, "It's exhausting. To be perfectly honest, tracking 4 times a day for 30-some weeks is a little traumatic. I have a therapist that I go to just for my own mental health purposes. It gets exhausting managing the condition." In our second phase of the Kolb cycle and our findings, a reflective observation, individuals investigate and consider contextual conditions of a problem. We teased 3 categories from reflective observation, the first being food-related reflective observation, secondly, condition-related reflective observation, and finally, data-related reflective observation. In this instance, we provide an example of food-related reflective observation where participant 12 emphasized that GDM took away her relationship with food. She says, "I used to love cooking and especially baking. Baking was a stress relief outlet. The diagnosis took away some of the stress relief outlets that I had and just replaced them with more sources of stress and anxiety. In abstract conceptualization, individuals constructed meaning, formed hypotheses, and considered possible changes to the context conditions across time and place. In this instance, participants formed hypotheses about their condition and experience. We observed abstract conceptualization in three categories. First, the gaps in educational support. Second, tracking and viewing track data. And third, considerations on broader implications outside of themselves, where participants highlighted the financial, ethnic, and policy-related considerations. Here we present an example of gaps in education support, where participant 10 stated the following. She said, a bad number referring to the sugar level being out of range could do a number on someone who's not able to respond to numbers meaningfully. There is some privilege involved in seeing the number and knowing you can do something about it. In active experimentation, individuals tested their key observations and newly formed hypotheses. Often experimentation was done around food and exercise. In case of participant 6, she highlighted that most people are told to exercise after they eat. And I think based on a lot of my numbers, it's almost better for me to do the exercise before I eat. And then she goes further to say, last week I tried eating some beans. I will try a quarter of a cup of beans and my numbers were fine. So then I was like, okay, well, now I'm going to try a half a cup of beans. And that wraps up every aspect of our finding. For more details on that, please read our paper. In the discussion in our paper, we focused on two main themes. First, we focused on supporting and managing the changing relationship with food. And secondly, supporting emotional well-being in a stigmatized and burdensome condition. We structured these support themes by offering design considerations for these themes at each phase of the experiential learning cycle. The discussion in our paper, for example, at Concrete Experience, we recommended a virtual learning environment or community that triggers additional support through therapy, especially for people with history of disordered eating. Again, this virtual learning environment would also promote respectful language, avoids weight stigma, and considers overall well-being. The key takeaways from our presentation are as follows. First, we highlight the challenges and burdensome experiences of individuals with GDM. Second, we offer design recommendations for supporting individual experiential learning within the condition. And third, we showcase an example of leveraging the highly influential Kolb's experiential learning cycle beyond reflection alone towards a more transformative experience. For more details, and if you have any questions, please feel free to reach out to us and please read our paper. Thank you.